back to Meds Made Easy. My name is Tarun. Today we're going to talk about Cialis, also known as Tadalafil. We do tons of this stuff here. People really love it. So it's used for erectile dysfunction, BPH, benign prostatic hyperplasia, and then also PAH, pulmonary arterial hypertension. So PAH is when you have sort of high blood pressure in the arteries of your lungs, which is not a good condition to have. It's a sort of a difficult condition to manage. So this medication tends to help with that. So again, you could be a man or a woman and take it for PAH. Erectile dysfunction, obviously for a man, benign prostatic hyperplasia. Also usually for a man, it's always for a man really. So I'm not going to go over dosing just because it's variable. You generally take it 30 minutes prior to sexual activity if you're taking it for ED. If it's for PAH, then you're taking it kind of like any other blood pressure medication. You're taking it like once a day in the morning or twice a day if that's what you're on. And you take it like kind of like any other med. So if you have liver or renal issues, make sure your doctor knows, because a lot of people go to different doctors, and so you want to make sure all your doctors are on the same page with the medications you're at, because this will actually raise your blood pressure a bit. And so people that have cardiac issues, you have to watch out for medications like these. Just make sure your doctor is in the loop on it. As far as the dosages go, the 2.5 is used for sort of an all-day dosing. So a lot of men really tend to like the 5 will wear off a little bit quicker. The 2.5 is kind of like an all-day low dose that you could take that could get you stimulated at any time. So again, here's the thing that I want to be able to explain to you guys is this medication does not cause an erection. It just kind of helps in the pathway to creating an erection. So when you are sexually stimulated, the vessels in your penis begin to relax, allowing blood to engorge your penis, and essentially that's how you get an erection. So what this medication does is it allows those blood vessels to relax and allow blood to get in them. So that's how it works. So if you take this medication and then think, I'm gonna get an erection, it doesn't work that way. You still have to be stimulated. You still have to be able to be sexually aroused in order to get the erection. This medication just kind of helps with that. Let's see here, for women that are taking this for PAH, it's kind of not suggested to use during pregnancy, but again, talk to your doctor about it. If you have PAH, then this is kind of a more serious condition. You really need to kind of go through your doctor on that. Don't just take my word for it and go on the recommendation of your doctor. Duration of action of Cialis is up to 36 hours, which is pretty great. That's why this medication is so popular, and I'll get into that a little bit later. Half-life, which is about half the medication gets out of your system in about 15 to 17 hours. So it's a very long-acting medication. So it takes over, almost 32, 34 hours. So you're looking at almost 2 days for one dose to really flush itself out of your system. It kicks in within an hour. And then I guess the main question you guys really have for me is, actually no, we'll start with the side effects and I'll end with the comparison to Viagra. So here's a list of side effects right now. So the main things you kind of want to watch for, the most common side effects are like headache, kind of limb pain anywhere. That's a bad sign if that's happening, or you're at an increased risk of respiratory infection. So if you take this medication quite often and you feel like, hey, you're coming down with a cold a little too often or whatever, then that's a sign of a side effect. So you need to get switched on to something else besides this. Now the main question in this video that people have asked is, what is the difference between this and Viagra, and which one should I be on? That's a great question. So Cialis is a longer acting medication. So I said the duration of action is up to 36 hours. Viagra's is only like 2 to 4 hours. It's a short-acting drug. It's in, it's out. It does its job. But Cialis stays in your body longer, which means as long as you continue to have sexual stimulation, you'll still be able to get an erection. So a lot of men kind of prefer this. In practice, we've kind of seen Cialis take over Viagra a lot. Viagra was kind of like that King Kong drug of erectile dysfunction. Now we've seen Cialis come through and be more popular with people. There's another thing is with Viagra, you have to, if you end up eating a really fatty meal, a meal with a lot of fat in it, it delays when you see the effect. Cialis does not matter. does not matter what you, with or without food, fatty meals, no fatty meals, it doesn't matter on absorption. So again, another great thing, if people go out on a Friday night, they want to go eat whatever they want to go eat, and then, you know, it's a date night, you don't want to have to worry about that as being something in the back of your mind. So again, I guess guys, that should do it with this video. I kind of went through the ins and outs real quick, but I know everyone always asks the Cialis versus Viagra questions. I want to make sure I did answer that. Leave any comments down below, hit subscribe, let us know how we're doing with the channel, and we'll see you guys next time on Meds Made Easy. Bye.